In Almusa Specialist Hospital, we value the safety of our patients. We are JCI accredited and we follow the international patient safety goals. OR Pack of ASH will present to you the 6 international patient safety goals. The purpose of IPSG is to promote specific improvements in patient safety and quality of care.
OR patient, endorsing patient, actually Rojarado for laparoscopic assistant.
In this video, it leads us to IPSG number 1, identify patients correctly.
Good afternoon. Good afternoon. Good afternoon. Hello, good afternoon, sister. May I know what's your name? What's your name, Ashwati Rojarado, file number 3482759. Patient for laparoscopic cholecystectomy under Dr.
The nurse asks the patient's full name and checking the ID band. In addition to that, ASH uses 2 patient identifiers. Patient full name and MRN should be considered before taking any treatment or procedures, administering medications, giving blood and blood products, and any diagnostic procedure.
PS release. Sisters, just wait. I will come back. I will just wait, babe.
IPSG number 2, improve effective communication.
Hello. What is your and Ashwati Rojarado, file number 311458, post left CPS release under local anesthesia by Dr. Iman Ramadso. I have there the dressing of bactigras, oxide, gauze, and crepe. And there is Fazoline 2 grams given free of, medically free, no known allergies. Temperature is 36.4, hemoglobin is 10. Alright.
In this video, our staff endorsed the post-operative patient by following ISBAR and handoff. ASH uses the tool ISBAR as simplified framework to improve effective communication. It is a standardized tool to assist clinical handover. In line to this IPSG, the hospital develops and implements a process to improve the effectiveness of verbal and telephone communication among caregivers in the process of reporting of critical results. By writing down, repeat, and confirm, the telephone order must be signed by the AP within 24 hours. IPSG number 3, improve the safety of high alert medications. High alert medications are drugs that bear a heightened risk of causing significant patient harm when they are used in error. The strategies to improve safety and prevent errors includes storage. HAMs should be stored in a steel double-lack cabinet to prevent easy access. Labeling, we should not miss out to put the high alert red sticker. And employing independent double-checking before dispensing and administration. In addition to that, the look-alike and sound-alike drugs are segregated to avoid confusion and avoid common drug interaction. The Joint Commission has also developed a universal protocol for preventing wrong site, wrong procedure, and wrong patient surgery. Errors of this nature are very infrequent, but when they occur, they can be tragic. This video will lead us to IPSG number 4, ensure safe surgery.
This is our patient?
Yes.
Yes, we can shift, please. I am tired.
Okay.
Yes.
Can we shift the patient?
Yes, Doctor.
Knife, please. Left, please.
Sign out. Doctor, sign out. Abdullah, sign out.
Sign out?
Can you confirm the procedure?
What sign out? I am sure what I did. No, I said you should be sent to lab.
Doctor, I said.
To avoid this mistake, the Universal Protocol consists of 3 major requirements. The use of comprehensive checklist that offers a guidance for pre-procedure including sign-in, time-out, and sign-out. Let's all witness how our staff portray the 3 comprehensive surgical safety checklist.
Can I do the sign in, please?
Yes, Doctor.
How are you? Good morning. What's your name? Aguila Rajit Paramon. Okay. 3531616.
Yes, Doctor.
Do you know what's your procedure, please?
Yes, Doctor.
anesthesia.
Where? In the left hand? Okay, the consent already right?
Yes, consent valid is doctor. Consent is ready.
Okay, thank you.
Dr. Abdullah, can you do the side marking?
Good morning, Akila. How are you? Fine. Are you ready for the surgery?
Yes, doctor.
Okay. Do you know what is your surgery?
Yes, I know. Ganglion excision.
Yes, left hand. Okay, so I will make site marking. Okay. Okay, good luck, and I will see you inside the shop. Thank you.
Dr. Hashim,
Yep.
can you confirm, is the anesthesia mission and medication check complete?
Yes.
Okay, is the pulse oximeter on the patient and functioning?
Yes.
Yes, it's working. Okay, does the patient have a known allergy?
No, she don't have allergy. Do you have any allergy? I will ask her again.
No.
No, she don't have any allergy.
Okay, does she has significant airway or aspiration
No.
risk? Any expected blood loss, doctor?
No.
Thank you. Sign in.
Sign-in is called before the induction of anesthesia. It is usually done in OR holding area along with the patient's status in presence of anesthetist and surgeon. It is a process to perform patient identity, verifying the recognizable site marking, presence of allergies, securing consents, anticipation of difficult airway, need and readiness of blood before patient transfer to the operating room.
Time out, please.
Good morning, time out. Patient name Asma Resident Karno, file number 343612. Confirm all team members with name and roles.
Abdullah Sirjun.
Subject in class name. Dr. Abdullah, can you confirm the patient procedure, site and position?
Left hand ganglion tissue excision in supine position under local anesthesia.
What are the critical or unexpected steps?
Nothing.
Operated duration?
30 minutes.
Anticipated blood loss?
Minimal inshallah.
Dr. Isham, are there any specific concern about anesthesia?
From my side, no, thank you.
Akabar, has certificate confirmed?
Certificate,
Patient receives oxygen to the time out over. Thank you.
Timeout. It is a final pause and final verification process to be done on a patient immediately before the start of procedures in the presence of all clinical team members to assure correct site, correct patient, and correct procedure, and that all documents, equipment, and implants needed are on hand, correct, and functional.
Sign out. Dr. Abdullah, can you confirm the procedure what you have done?
Left hand ganglion tissue excision.
Akabar, your instruments, sponge, needle pumps are correct.
Yes, come correct.
A specimen, what is the specimen name?
The ganglion tissue.
Specimen level and sent to laboratory.
Thank you.
Any equipment problem issued?
No.
Consent is Dr. Nisha. What is the destination of the patient?
Patient will go to the regular recovery.
Okay, thank you. Sign up over.
Thank you.
Sign out. It is a process done before the patient leaves the operating room to confirm the actual procedure, instruments, needle and sponge counts, specimen labeling, and any other concerns. IPSG number 5. Reduce the risk of healthcare-associated infection. Infection and prevention control is challenging in most healthcare settings, and the rising case of hospital-acquired infections are major concern for both patients and healthcare practitioners. The common hospital-acquired infections are CAUT, catheter-associated UTI, CLUBC, central line-associated bloodstream infection, MDRO, multi-drug resistance organisms, SSI, surgical site infection, and VAP, ventilator-associated pneumonia. The key in preventing infection is hand hygiene. The hospital adopts and implements evidence-based hand hygiene guidelines to reduce the risk of healthcare-associated infections. PPEs or personal protective equipments are worn if and when is necessary to protect ourselves and our patients. This video will lead us to IPSG number 6, reduce the risk of patient harm resulting from falls. All inpatients and outpatients coming from procedures should be screened for fall risk. Al-Musa Specialist Hospital develops and implements a process to reduce the risk of patient harm resulting from falls by using a falls risk prevention tool, Morse fall scale for adults, and Humpty Dumpty for pediatric patient.